Hello, my name is Dr. Olusomisola Oyesiku, frequently called Dr. O. I am a medical officer at the Alabama Department of Public Health, and today I'm going to be talking about tuberculosis and pregnancy. For today, we're going to mostly be discussing TB in pregnancy and why it matters. We're going to be looking at how TB transfers between mother to child. We're going to be discussing briefly the impact of latent tuberculosis infection and just overall strategies for prevention, management, and recommendations for TB in pregnancy. So, like my colleagues have previously discussed, TB is a contagious bacterial infection, mainly caused by Mycobacterium tuberculosis, affecting the lungs and other organs. TB primarily affects the lungs, but it can also go to other parts of the body called extrapulmonary TB. We have two types of TB. We have the active TB and the latent TB, and it has a great global impact in affecting about a quarter of the world population. And TB accounts for almost 50% of maternal deaths worldwide. Now, why does it matter that we're discussing TB in pregnancy? This is largely because of the complications that arise in pregnancy due to TB. Now, TB during pregnancy leads to anemia, preeclampsia, low birth weight, and a higher maternal death rate. Active TB weakens the immune system of the pregnant woman, and it impairs the placental function, which feeds the baby. And all of this leads to worsening pregnancy complications. Worse, co-infection with HIV further intensifies the risk associated with TB during pregnancy. And it also leads to worse outcomes in the fetus and the neonatal period. Higher risk of birth, low birth weight, preterm birth, intrauterine growth restriction, and infant death are some of the complications of TB that occurs during pregnancy. Now, what are the symptoms of TB during pregnancy? This largely mirrors the effects of non-pregnant states. Symptoms like fatigue, cough, night sweats, fever, and it's very similar to the non-pregnant state. But during pregnancy, diagnosis can be delayed or deferred. Now, because of the weakened immune system during pregnancy, there is also a risk of extrapulmonary TB, which is TB in other parts of the body, which can involve the genital urinary areas, complicating diagnosis. Now, we're looking at LTBI, which is latent form of TB that is asymptomatic. That means you're not showing any signs or symptoms of TB infection, and it can progress to active TB. And pregnancy-related immune suppression can actually trigger active TB in about 10 to 20% of women with LTBI, raising the transmission risk. Therefore, preventative treatment of LTBI can reduce transmission risk, but is often underutilized due to the diagnostic and safety concerns. We have many treatment options for LTBI, both in pregnancy and before pregnancy. So, what do we recommend? That we screen all pregnant women at risk, especially women in high-risk groups such as HIV-positive mothers and patients or women that immigrate from high-burden countries, or if you've been in close contact with anyone recently diagnosed with TB. We use a symptomatic screening questionnaire, we have screening tests, and we also have chest x-rays that are used to diagnose both LTBI and active TB symptoms in pregnancy. We also have the test called the IGRAs, and these are blood tests such as the T-spots and the quantiferon that is preferred for LTBI detection. And then we have different treatment options that can also be suitable for pregnancy. Monitoring and adherence is key for successful treatment. Now, why is LTBI prevention, that's both testing and treatment in women of reproductive age, underutilized? Well, there's safety concerns in pregnancy that if they do detect them, can it affect the liver or the baby? a lot of providers are not aware or have this uncertainty about the screening criteria for pregnant women and if there's any pregnancy-safe treatment regimen, and the fragmented care system. And a lot of patients, just because they have no symptoms of LTBI, do not see the need to actually get tested and treated. And of course, the social stigma that might be associated with TB, or immigration concerns, or just overall socioeconomic priorities. So what are we saying? Management and treatment of TB, both active and latent, in pregnant women has to be individualized, and it would take a multidisciplinary approach. That means it would take a collaboration among your obstetricians, the infectious disease specialists, pediatricians, and even your primary care to deliver a great outcome in pregnancy and also improve the health of the fetus. So, what are the key takeaways? TB in pregnancy is treatable. Prevention of mother-to-child transmission is vital during pregnancy. LTBI requires monitoring during pregnancy due to risk of progression of active TB, and early diagnosis and treatment improves outcome. Here at the health department, we do offer free TB screening and treatment. So if you feel like you have any of the symptoms of active TB, or you feel like you've been in contact with anyone recently diagnosed with TB, go to your nearest health department for both testing and treatment if positive for TB. Thank you so much for taking time to listen to this presentation today.